So today, inshallah, we're going to talk about occupational health. As a lot of diseases, a lot of problems you're going to face in your clinic later on, even if you are a surgeon, you are internal medicine, family medicine, psychiatrist, whatever, pulmonologist, cardiologist, you might have a lot of patients. Their problem or their disease is related to their occupation. You might have a strange disease. Their occupation is actually playing a role in what's going on with them. Do you think occupation affect our health?
Yes.
Yes. About our health can affect our occupation?
Yes.
Yes. If our health is not right, do you think your productivity is good? If you're not happy at work, do you think your errors will be less or more? More. Your productivity will become less, your creativity will be less, right? And your health will be in danger. Not only with pulmonary disease or heart disease, but with injuries. Do we see injuries from occupation? A lot. I remember the first time I was doing my moonlighting. You know what moonlighting means? When you are licensed, after 1 year of residency, some states you might be a licensed physician, so you can do moonlighting. Moonlighting means you do an ER or urgent care, and you get money for it, like $100 per hour. It's kind of nice. 12 hours, 24 hours, like $2,400 in take. You are still a student resident. The first time I was there, actually, I had a guy coming with the builders. You know those guns, the nails guns? Mm-hmm. So the first one, a nail coming to his, to his nail, to his finger. I see the nail from here, for me as a resident was, I didn't have this before. So I did X-ray and I asked someone what you do, and then we remove it. So injuries, we see this a lot. Now, do we have a lot of occupational diseases? How many diseases we have? 160 million. So you need to memorize half of them. It's going to be in the exam. Just half, not all. No. So we have a lot of diseases. We have a lot of risks associated with our jobs. You are an employee. You are a worker here, right? As a student, right? Are you exposed to any occupational hazard?
Yes.
Like what?
Mental health.
Good. So that's true. COVID. Yes. What else? As a student? Someone said stress, mental problems.
Maybe allergies to the chemicals when you go to the laboratory.
You might be exposed to chemicals, evaporations of the chemicals, about physical. Yes, of course. About needles exposure. 1 in 10 physician or nurses or anyone in the medical staff, they might have a needle exposure. So many times I have nurses coming to the ER, panicking. She had a needle exposure to someone with HIV. You see this? Or hepatitis B or hepatitis C. So this is really dangerous. So we are at risk for sure. How many times we see patients coming from the same department with the same problem? One day, I have employees coming from the kitchen, coming with cutting their, having wound cut. So what's going on with this? I called one of our really good one. Her name is Tara, a UK occupational expert. She's a nurse, but she had different studies to become an expert in this. So I said, Tara, please go to the kitchen, make an assessment. What's going on there? Why they are cutting their hands a lot? Really, like every few weeks we have someone coming with a suture. So what do you think we should do when we have an area where we have a certain disease from that area? What you should do?
Investigation.
How we can do the investigation?
Set of occupational specialists.
So you need to
Identify
identify the hazards, right? Let's say someone coming with a lung disease, right? So what's the hazard? You need to identify what kind of hazard. As you said, chemicals exposure, right? Maybe the quality of the air that they are smelling in the plants, the factory, the departments. So we have to identify what's going on, what's the hazard that they are exposed to, right? So I said my expert, our nurse, the occupational nurse, said, please go there and see what's going on. So she went there. So you have to go around the area, identify how they are doing their business. What's the process of their business? She found out after watching them for a day or two that they have a long hours, they don't have breaks, they are short staffed, so they are working really over their abilities. Is this harmful?
Yes.
If I ask you now today to have the whole day lectures, right? And tomorrow you have an exam. This is beyond your ability. You cannot do it. If we have some of the students wrote a letter, please for everyone to forgive me and I'll see you in the hereafter. We did a survey actually a few years ago. We found some of the students, they have this intention. So stress, is important. So this lady, she said they are short of staff, they have long hours, they don't have breaks, they are not really happy, with their, managers that don't understand that there's no good support. So we asked the managers to come. So listen, you have a problem. So but we are short of staff. So this is not the employee's problem. You have to do something else. Hire someone from outside, give them a breaks, and then we will see you after a few months and we will reevaluate it. So you go there, you identify the hazards, what's going on. Is it chemicals? Is it physical? Is it social problems? No support? Is it interpersonal problems? Why I have patients coming to my clinic, men crying because of like too much work, beyond my abilities, beyond my time and location. I don't have time to do all of this. So we see this. Do you have the heart attack? We call it the sympathetic heart attack. Can people have heart attack because of too much sorrow or too much stress?
Yes.
Of course. Young people, yes. You see this. Hypertension, your diabetes will go up like hell. We see this. So occupation affect us and our health affect our occupation. Why now governments, mashallah in Saudi Arabia now, they have mashallah in Ministry of Health, they have a section. It is for the safety at work. They cannot clear you unless they have a good safety measures to your employee. So they come to the plant, they have a lot of noise, you have to have ear protection. They have now dangerous machines, you have to have the right personal protective measures or equipment. What's our not this one, this one. We have this one now, right? This is personal protective devices or measures or whatever because of COVID, right? So this is really important. Why they are doing this, the governments, why? Because they are reducing injuries. When you reduce injuries, what do you do?
Reduce cost.
The quality of work, the cost is really important. Let's imagine that you have every day you have someone with low back pain, sick leaves, you have people coming with injuries, you have people with a chronic lung disease, right? This is too much costly to the government. Now, for example, if everyone stops smoking in Saudi Arabia now, today, smoking exposure, how much do you think the percentage of lung cancer will go down to? 90%. No one said 90. Yes. 90%. Imagine this, the exposure that we are exposed to. So, more creativity, less injuries, the cost is much better, and more productivity and more profit. Now they found, you remember this recently in Finland? They found why we don't do 4 days of work instead of 5 days during the week. They did this, and they found out productivity is much better, creativity is much better. We have better, work-life balance. So when we are pushing ourselves, squeezing our mind, squeezing our heart, squeezing our, social, interpersonal relationship. See? You remember before, when you have to work in the future, in the past, you have to come from 9 to 5. Your finger prints, okay? When you go into your fingerprints. Excuse me. In the future, come anytime, work from any place. Okay? You can become leader anytime. You use your ladder. You don't go with the corporation ladder. You use your own. Now it's really amazing. Our jobs in the future will be changed for sure, and you might have actually a change in your profession. Now I told you about this, and I'm sure maybe next week or the week after, how I can do my consultation through my WhatsApp. Yesterday, I have a patient's son called me panicking. Dr. Suarez, my father is not really taking his breathing. He lost his consciousness. He's on the floor. What's going on? He's shivering. He said, send me a video right away. Take it easy. Is he breathing now? He said, yes, but it's difficult. I said, okay, put him on the side. Looks like this is seizure. Put him on the side. Okay, check his pulse. He had pulse. Okay, send me a video. Send me a video like this. I said, that was seizure. Okay, don't worry. It's okay to have a seizure. Just put him on his right side or left side. Make sure he's breathing, his tongue is not in the back. Yesterday's problem. He had a stroke, by the way. He's in the ICU now. So it was a seizure because of stroke, and he had also meningitis because there's a shunt also. So it's a long story how this happened. But our job has become different. It's become different. Yesterday I was visiting a VIP, and one of the palaces in Riyadh. So one day, I have the lab with me. I opened the lab from in our hospital. I opened it from her home. Okay, I opened the lab, all the past medical history. We talk about 1, 2, 3, 4, 5. Our job is different. Patient, shouldn't be impersonal or in person in front of you, right? Sometimes you need to do a test. So you might ask them, stand up. I do a lot of tests. I said, okay, have the patient lay down, sit on the bed, have him lay down, his head 45 degrees to the right or to the left, have him lay down. Can you see his eyes? Yes, doing like this, nystagmus. Okay, this is the meningitis, this is vestibular disease, don't worry about it. Just give him beta cell. So our job is becoming different. So the promotion and maintenance of the highest degree of physical, mental, and social well-being of workers in all occupations. So what kind of services and what kind of exposure that we are exposed to? We might have chemicals, physical, as we said earlier, biological, hazards, non-occupational stress, ergonomics. Do you know what ergonomics means? Can I have one lecture about it? Ergonomics means the equipment that you are working with, your chair, the level of your computer in front of you, the setting that you are in. Those are ergonomics. Those are not right, you are not right. Back pain, neck pain, shoulder pain. We have before the employment, and we have during the employment. What we should do before, a physical exam. Make sure you don't have HIV for the medical staff, you don't have hepatitis B or C. And after that, we have to do all this services. Don't worry about it. The injuries are too many injuries, as I said earlier. You might have, low back pain is always the number one problems. Lacerations, eye injury, dermatitis, lung disease, hepatitis, cardiovascular, and death. Examples, lung disease, you have sometimes asthma because of occupational, pneumoconiosis, cancer of the bladder, some of the materials that they are exposed to. We have cardiovascular problems, toxicity, reproductive some materials that can get some females to become, to have infertility, psychological, musculoskeletal, and you name it. So we have 2.6 billion workers. Can you name any of these workers?
Teachers.
Hundreds, huh? Of course, half of the population of Earth, they are workers. And 179 million children in the hazardous work, over 2 million deaths on a yearly basis. The problem with this death, that most of these injuries and diseases can be prevented. That's the take-home message of this lecture. 160 million diseases and 270 million non-fatal injuries. Personal protective equipments are different. It depends on your occupation. If you are a carpenter, if you are a builder, if you are a doctor, it's like different thing. It's easier to prevent than to cure, of course. Much easier, less costly, less expensive to prevent than cure. What's our job in primary medicine? Cardiology, they receive patients when they have heart attack, right? For us, no, before. Overweight, this is a risk factor. Diabetes, control diabetes. Hypertension, control hypertension. Okay? Different scope of medicine. So to prevent is much easier to prevent than to cure. Cancer, you are exposed to a lot of asbestos, a lot of building materials. So you are exposed to have lung cancer, God forbid it, for some people. So it's always we look into this. Like a lot of people coming to me for physical exam, annual physical exam, right, in my clinic. So okay, do lab, we talk about this, so we have a lecture about it. So we do lab, screening test, and then we talk about BMI, we talk about how many minutes you do every week, exercise, and to prevent things in the future. Something happens from now, this is a different story. But do we have to prevent our, to do it earlier, to prevent it from happening? Yes, we have to do it. I've seen a lot of things like this, especially when I was in the military. In Syria, we have a lot of injuries coming to the hospital, and I was like a lot when I'm on call. I'm the only physician in the whole hospital, and you have injuries, you name it. This is careless, right? People, they said اللي عنده عمر ما تقول شدة صح؟ اللي بقى له عمر ما تقول شدة. Actually, nothing will happen, inshallah. Inshallah, it will be fine. This is wrong. It's not going to work, right? Wrong ولا مو wrong? It is wrong. عقلها
وتوكل.
So a lot of injuries, you have to get through them. This is not smart. MashaAllah, I have an employee and he will do the job of 10 employees. Correct. This is his last picture. See him pool and doing this drill. Well, I've seen, I lost one of my friends. I was like in 5th grade. They have matba'a in Syria, one of the factories in Syria. He was killed. He fell down in one of the big containers for chemicals. And he was dead in that area. I just remember him. So safety measures is really important. Preventing things is really important. So we see a lot of injuries. This is another smart gentleman here. Injuries everywhere, any organ that you can imagine, including eyes, skull, you name it. This is that smart. So different, personal protective equipment. Face shield is really important, and goggles, different types for different, professions. I was in Turkey one day. Those they do grava, they have flour everywhere and they smell it, and and I told one of them, just have a mask, at least you will reduce the exposure of the flour. So the flour is good, no problem when you have a big belly like this. صحة تمام صحة تمام صحة تمام. This will affect you later on. Hand protection. It's always one of the things we need to watch. Helmets, hard hats is really important. This hat, do you think will help him? He has a hat. It's not only ولا تسمع.
من جوا.
Sure. Now, ear protection is really important. You know, the problem with hearing loss, that it is actually gradual. People, they don't notice that they have hearing loss until they have really a big problem. I usually start with the speech, right? I always bring this in the exam. See the different safety measures. The third world and the first world. This is also his last picture. So, this is the rule. I always look at in the exam. I wanted to memorize it. What's the rule when we have to use the ear protection? If you have to shout at someone standing 3 feet away, like 1 meter away from you, to be heard over the noise. So it means the noise is like too, big to happen. Sometimes they do like how many decibels and all this stuff. Now it's available, but this is just to give you an idea how we can do things. As I said earlier, hearing loss from noise exposure is usually not noticed because it's so gradual. Usually a person loses the ability to hear higher pitches first. Why speech? Because speech has different tones, right? High pitches, lower pitches, down. So sometimes you cannot recognize the whole word. You have some of them. So we have different ones. So we have injuries, occupational risk factors account for injuries, 10% of all injuries, back pain 37%, hearing loss 16%, so it's very common. 40% hepatitis B, 40% hepatitis C, 2% HIV. It's always, musculoskeletal is number 1 occupational hazard. The problem with occupational disease, the only reported is like so tiny. That's why, inshallah, when you become, inshallah, a consultant in any profession, keep in mind to ask your patients, what's your profession? What do you do for a living? Why? Because it might be related. You might save some other people working there. You might have, help the family who are, in the same, environment, might be exposed to these hazards and might have the same problem. So a healthy job is likely to be one where the pressure on employees are appropriate in relation to their abilities and resources, to the amount of control that they have over their work, and to the support they receive from people who matter to them, as we explained. Do you think this is a healthy job? Just a funny example about a healthy job. Do you think this is healthy?
No.
It's very healthy, sir. It will relieve from all pain and all hazards and all stress in one shot. And maybe in China they have a lot of people, so it's okay to lose one guy every day. It's no problem. Anyone will do it for 100 riyal per day? تاخذ 200 ولا تساوي. So why risk assessment is important? We talk about it. So how do risk assessment? Identify the hazard, decide who might be harmed and how, evaluate the risks and decide on precautions, record your findings and implement them, review your risk assessment. What's the hazard? Anyone can read this for us?
A hazard is anything, that may cause harm, such as chemicals, electricity, working from ladders, an open door, etc.
Name it. Right? And the risk is?
The risk is the chance, high or low, that somebody could be harmed by these and other hazards, together with an indication of how serious the harm could be.
True. So this guy, do you think, what's the hazard that he might be exposed to?
Shooting.
Also.
Death, injuries, right? Not just funny, thing, but just to teach you how we do this. Now, decide who might be harmed and how? Himself, people running around, his friends, people living there, evaluate the risk and decide on precautions. So he might be killed, he might have injuries, not all of this. We have to record down, this is the hazards, this is what we can do. Can we eliminate the hazard itself? Yes. Put him away, put this on the floor, fix it on the floor, and he will be fine. Review the risk assessment, go there, do the assessment, write it down, and then every year you go back to that factory and make sure the risk assessment is under control and no sick leave, no injuries, and all of this. This is the table we use usually in occupational hazards. You have the potential severity of the harm. Is it extremely harmful, slightly harmful? The likelihood of harm occurring, high, unlikely, or very high. What do you think our patience is? Here are number 9. So what things do we have to include in the risk assessment? A proper check of the hazards, ask who might be affected. We talk about this also, but there's something to remind you how we do this. So those are the steps. Again, we are writing down here. We talk about this, so you have to go around, identify the hazards, ask the employee, find the sick leaves, find the medical records, find in some department they have a certain disease, why they have this. I always bring this exam, one of the departments, they have headache, everyone. Most of them, they have headache. Most of them, they stay in the same office. So why they have all this headache? Since they're starting working in our hospital, what's going on with them? They did MRI, CT scan, nothing wrong. And then we found out that it was a CO, chronic intoxication. So they have a furnace, and there's a leaking from that furnace, and we found out that was the problem. We talked also about this. Some jobs are really sensitive, like pilots, like nuclear, jobs. You have to pay attention to some, occupational hazards related to that occupation. And we will talk about environmental, health also. We have the lead as an example. Also, we talk about this. Now, evaluate the risk and decide on precautions. Can I get rid of the hazards altogether? If you can, that's the best. If you cannot, you have to have a simple, cheap solutions. Okay, get the hazards away if you can. If not, if we have a lot of exposure, try to contain this, materials. Get it away. Have a small amount. Have masks. Have whatever measurements that you can do to reduce the risk. If you cannot get rid of all of it, you have to have a fast and quick solutions, and you have to have a long-term solutions. Now, we don't expect the risk assessment to be perfect, but it must be suitable and sufficient. Sometimes you cannot control everything in the factory, in the department, everything, or all the stress. You can have, a simple, reasonable solutions, for this risk that is associated with the problem that you are facing. We talk about this problem that happened in one of the little town in Missouri. One of the popcorn plants that they mix a flavor with the popcorn. They have a strange, rare disease in the factory. Employees. The problem was they have a lot of patients. A lot of employees can with a shortness of breath, they have a cough, they have decreased sounds on the exam and basilar rounds. Chest X-ray, they have a lung expansion, they have non-reversible obstruction with the pulmonary function test. Diffusing capacity was normal, a CT, there was a bronchiectasis and air trapping, the expansion. Lung biopsy, they found out fibrosis and narrowing of the bronchial system. They call it the BO, the bronchiolitis obliterans. This is a rare disease.
Do they also call it popcorn disease? I think popcorn lung disease.
Popcorn disease.
Lung disease, yeah, I think they also call it that.
Maybe after they found out about
Yeah.
it. That's true. So this is because of. Now let's say you've been, asked to go and see what's going on. What's your name? Muhammad. We asked Muhammad, we have a certain disease that's very rare. Why it's more common in this factory? So for Muhammad, what do you want to do?
Go and check the environment and the ingredients of the popcorn.
Check the ingredients, check the process, what they are doing. We have the mixing, let's say, department. We have the packing department of the factory. We have the ones who are at the sales at the end. We have, so you need to go and see what's going on. So you have to go around, ask the people, ask the employee, ask the managers, what do you do here? Go and watch in your, eyes what they are doing. Do you need to know anything else? The materials that they are using.
Yeah, for
Yes.
flavors and
Yes. Give me, we call it the material data sheet. Every factory, they have to have this list of materials that they are using. And you have to check. Do we know that this one causes lung disease, this one causes heart disease, this one causes cancer? So we have to do this. So Muhammad went there and he was seeing all of this. And he said, okay, the process we have to have the mix, the salt, oil, and flavoring. We have the diacetyl and spices. They combine, mix them together with the corn, and they pack them later on. And Muhammad said, okay, we need to know the sample of the air. We need to sample it. We see where is the highest concentration of this material, and to apply this on the number of patients who are affected with this. So let's say here the air sampling of that diacetyl or the spices that they are mixing this with, and they found it the highest in the mixing room. So you expect the number of patients or the employee who are affected with this disease are mainly in the mixing room. And that's what happened. So Muhammad went there, he identified the risks, identified the hazards. The likelihood is more in the mixing room, the number of patients is more in the mixing room. And he said, okay, I think the flavoring materials are affecting the lungs. Now, this might be new. We don't know that this material, the diacetyl, is actually causing this. And that's true. From that event, or from that accident that happened, or incident that happened, from that on, day on, he said, okay, this material can cause this rare pulmonary disease. So he found out we have 425 employees in that area from 1992 to 2000. 4 of 8 with the BO worked in the mixing room, other were in the packers or the packing room. It is a rare disease, but here it's more, almost like 4% or like 8% or 2% or whatever. But the percentage is much higher than the normal population. Surrounding community is really important. All these materials are flying in the air and causing this to the neighborhood. I told you about we've been asked to go and evaluate one of the little town in Medina, close to Medina, that they are exposed to one of the factories, materials, the waste material. The whole village, they wrote a complaint to the government that we are exposed to this and we have more cancer than others, and we are asking for compensation. We went to that area, and we have pictures, and we went to the factory, and we see in their dumping area, and we had samples from the air, we have samples from the soil. We found arsenic in that area, and then we went to the water that is supplied to the homes. We didn't find arsenic. We go to the medical records of the little, they have clinics, local clinics. We went to those local clinics. We had the medical records. We had all people from Medina who had cancer from that, I think like 20 years back. I said, okay, is it more concentrated in this little town? It wasn't. Do you have more asthma in this little town? It wasn't. So the complaint was not really valid scientifically that this dumping area causing this problem. Okay. So employees in full respirators since then. So you cannot, actually you have to purify the air that's coming to your lungs. Products since then, it was labeled as irritating. Material safety data sheet not reflected. Inhalation hazard until 2000. Just to, I hope that you got, some idea about occupational hazards and risks and what we can do about it. I want you to take home, a take-home message, or in your inshallah career, ask about occupation. Whenever you see people is not really responding well to asthma, to COPD management, ask about his occupation, his condition at home. Do you live close to that factory? Do you have any refinery, maybe factory close to you? Any contaminated wells? When you see teeth, problems in the whole little town, check maybe in the environment we have something else. Thank you very much. Any question?
Thank you, Dr.
Okay.